We've still got no reauthorization of the CHIP program. Unreal! Maddening! But it just got much, much cheaper to fund the program. Why? Budgetary gimmicks! Strap on your thinking caps and get ready for some wonkery. This is Healthcare Triage News. Quick review. The Children's Health Insurance Program, or CHIP, is a long-running public insurance program that gives healthcare coverage to 9 million low and middle-income kids. It's hugely popular. It ran out of money more than 100 days ago. Congress has yet to reauthorize it, even though it enjoys true bipartisan support. States have been warning people they could run out of money. Yes, Congress did set aside a couple $2 billion to cover bills for the next few months, but still, no reauthorization. The most commonly cited reason for difficulty is the cost. Just a couple weeks ago, it was estimated to be $8 billion, but now, by magic, it's only $800 million. That's peanuts! It's just $160 million a year on average for the next 5 years. It's nothing. How did it happen? Congress passed a tax bill. I know, confusing. Let's back up a bit. It's expected that if we don't reauthorize CHIP, then some parents are going to have to go to the exchanges to buy plans for their kids. Many of those parents will qualify for government subsidies. We have to pay for those subsidies. When the CBO figures how much CHIP costs, it takes into account how much we'd have to spend on CHIP versus how much we'd spend on other programs like exchange subsidies if CHIP went away. As part of the tax bill, now law, the individual mandate was eliminated in 2019. That will make fewer healthy people buy insurance. That will make premiums for exchange plans go up. That will make the subsidies that the government has to pay go up. That will make people taking their kids to the exchanges cost taxpayers more than before. Before the tax law, it would have cost $8 billion more to pay for CHIP than to pay for other things like exchange subsidies. Now, when the CBO redid the calculations after the tax law passed, it'll only cost $800 million more to pay for CHIP. Yeah, this is all budgetary hoo-ha. CHIP won't actually cost less, but now it will cost us more than before not to have CHIP. Thank the tax law. The bottom line is that there's even now less of a reason not to pass a reauthorization. We're going to pay more than $7 billion for kids' health care in the next 5 years, no matter what we do. The question is whether Congress can come up with an extra $800 million over the next 5 years to cover more kids with better health care. It's 0.1% of the cost of the tax bill. I think they ought to be able to figure it out. We like to make videos about sometimes controversial topics like drugs or sex and stuff like that YouTube doesn't want to sell to advertisers. And that's fine, because we care more about the content than we do about the money. That said, any help you can give us to help make the show bigger and better is also appreciated. And one way to do that, maybe the best way to do that, is through a subscription service called Patreon.com. You can go to patreon.com/healthcaretriage, make any donation you like, $1 a month. All of it goes right to the show and helps us make the show bigger and better. Finally, we're getting to the end of the year. It's gift-giving time. What would be better than Healthcare Triage merch? Mugs, lunchboxes, posters, little key fobs, hctmerch.com, and of course, my new book, The Bad Food Bible. Best gift you could possibly give this year. Go buy a copy now.